Every kit packaged in this room will save the life of a mother who would otherwise have died due to excessive bleeding. These girls report here every day at 4 p.m. to package the uterine balloon tampon, UBT kits, ready for distribution across various health centers across the country. The kit, comprising of a catheter and a condom, is usually inserted into a woman's uterus to stop after-birth-related bleeding. But did this vital innovation will not have seen the doors of Kenya health facilities if it were not for the pioneering efforts of Dr. Monica Ogutu.
I was the nursing officer in charge of the OBS-GYN department, and every day you witness these complications, women dying and also maybe coming with terrible complications.
She quit her job as a midwife nurse at Kenyatta National Hospital in 1995 after 15 years of service that inspired her to come up with the noble initiative of reducing maternal deaths.
The number one killer, which is also in this report that was released just last week, is still the postpartum hemorrhage. A woman walks in, delivers normally, and she starts bleeding. And if there is no immediate care, you lose this mother. Within 2 hours, you have a corpse.
She founded the Kisumu Medical Education Trust to bring home the UBT invention. And since then, she has managed to save the lives of 415 women using the device.
When a woman is bleeding, because we have the steps, the first step is always to give a drug called oxytocin. And when this drug does not work, because most of the times when there is uncontrolled bleeding, it means the uterus is not contracting. You are giving the drug, but the uterus is not contracting. It's usually common in cases like twin pregnancy, cases like prolonged labor.
Recently incorporated the UBT into the national policy of fighting postpartum hemorrhage among expectant mothers. Dr. Ogutu's institution has so far managed to distribute kits to over 1,000 health facilities in 15 counties across the country.
We started working with midwives, and we trained them and we equipped them. And during that process, we realized that actually, even the evidence is there, most of the women who suffer the worst complications are adolescent girls. But nobody gives them the right information.
During her service as a nurse and midwife at the Kenyatta National Hospital, Monica realized that maternal death related to excessive bleeding can be reduced instead of using the conventional treatment of removing a woman's uterus in case of prolonged bleeding.
We know in Africa, motherhood is that uterus. So we are looking for innovative ways. One, to prevent that death. Two, to save that uterus. And three, to make it more affordable, because that process is very expensive. So with this uterine balloon tamponade, it's now very easy to actually manage the uncontrolled PPH, postpartum hemorrhage.
Monica has since managed to set up 17 projects to help teenage mothers and orphaned children. As a way of empowering them economically, she pays them for assembling the UBT kits at the facility.
The young girls in our center, in the program called Sisterhood for Change, they are actually the ones who are assembling this. So it's by women for women.
Despite earning international recognition for her passion on maternal health, Monica says she is yet to achieve her dream of reducing maternal death to zero, especially in marginalized places.
To me, it's a joy to see women really on the driver's seat and driving women's agenda issues. And I would like women to get up and speak out.
Nancy Onyancho, K24, Evening Edition.